So, namaste, good evening. Hope you all are having a wonderful day. I'm Dr. Dhanya, Senior Medical Officer and co-host for today's session. We are truly delighted and honored to have you all with us. Just a few house rules before we get started. Only the first 1,000 participants will be able to join through the Zoom link, and the rest can watch the live stream through our YouTube channel. For an uninterrupted listening, invitees has been muted and the videos has disabled. If you have any queries during the webinar, please convey it through the Q&A box, which you can see at the bottom of the Zoom panel. We thank you for the cooperation. The schedule of the webinar will focus on Marma Chikitsa in osteoarthritis knee. Now, I would like to request Dr. Anil Kumar, our Executive Director, to deliver the welcome note. We are greatly honored to have our renowned speaker and moderator for this session. Over to you, sir.
Thank you, Dr. Dhanya. Very good evening and namaskar to all doctors and participants of this webinar. It's my pleasure to welcome all of you to today's webinar, which is conducted by Care Foundation, which is Kerala Ayurveda Research and Education Foundation. And actually it is sponsored by Kerala Ayurveda Limited. And this is a continuous education program. We have been conducting several webinars with the various subjects relevant to the period. And this today's is basically focused on Marma Chikitsa. And this is a continuation knowledge sharing program also with doctors and also for the youngsters. So Marma Chikitsa, we all know that it is part of Ayurveda, and this method of treatment has been kept alive by the traditional physicians of Kerala till last maybe the beginning of this century. But over a period of time, the practice has, the popularity has lost because due to various reasons. And very few Marma practitioners are seen nowadays, especially in this field. But the new generation, the college education students are coming up and they are now focusing on the specialization, and more of Marma Chikitsa practitioners are coming up. And if you see the history of Kerala, I'm talking on behalf of Kerala history, because this has flourished in Kerala because of the martial arts Kalaripayattu and also the dance program called Kathakali. Because these artists and the warriors of Kalaripayattu, they generally go for a periodical treatment to keep or maintain the flexibility of their body. So many Ayurvedic doctors were there, or traditional physicians were there, who used to provide this kind of treatment. But when this new generation or the new era has come up and this kind of old practices has gone down, the practice of this Marma has also come down. But fortunately, the traditional Ayurvedic physicians in Kerala has imbibed and taken most of the Kerala these treatments and made it into a special Kerala Ayurveda treatment therapies. So we call it Kerala Special Therapies, which has most of this, the massages, various type of massages, and the all body massages, synchronized massage. Then we have the Pindus Veda, Dhara, Pirichil. All this they adapted and adapted these techniques from the Marma or the Kalaripayattu or the Kathakali practices and made it suitable for therapeutic treatment. So that's how it has become now practiced in Kerala as Kerala Special Therapy. And now this has been popular throughout India. And this has contributed many benefits to the Ayurveda for the cure of many diseases. So I'm not talking much on this subject because we have very good expert today. We have fortunate to have Dr. Shishir Prasad to be the major speaker in this, main speaker in this program. He is a diploma, he is a PG, MS Shalyatandra and PG diploma yoga and assistant professor of Department Shalyatandra from Uttarakhand Ayurveda University, Dehradun. So he will be formally introduced by Dr. Godwin, who is going to moderate this program. So I'm just briefly introduce Dr. Godwin. Godwin has been with us for more than 10 years, and he has a long 18 years of clinical experience, mostly in the inpatient hospital. He is one of the most sought after Ayurvedic physicians in South India for chronic and complicated diseases, neurological diseases, including autoimmune diseases. Sorry. I recollect that the period when we had the serious COVID impact. He was, by his wisdom, he has developed few protocols which has been very effective, and this was accepted in Tamil Nadu, especially the Vellore district collector came to know about this, and he called him, and then there was those time the modern medicine was only allowed to be practiced for the COVID, but collector allowed him to do Ayurvedic treatment, and he has developed 3 protocols mainly on the mild and the chronic or the serious COVID, and we have provided medicines to the collector, and many camps has been done with the leadership of Dr. Godwin, and it was a very successful and appreciated by the Tamil Nadu government. So he was so active, and he's a very popular doctor, and he is currently heading the medical team in Ayurveda Gram, Bangalore. So with these few words, I introduce Dr. Godwin and request him to moderate this webinar and also introduce Dr. Shishir Prasad. Thank you, Dr. Godwin. Over to you.
Thank you, Dr. Anil Kumar, for the welcome address, for warm welcome. Hello, everyone. Good evening. We warmly welcome you all to this, special webinar by our expert speaker. So I have the honor and privilege to invite our speaker tonight. So a little bit about his introduction. Dr. Shishir Prasad. He has done his MS Shalyatantra and PG diploma in yoga. He is currently working as associate professor in Department of Shalyatantra in Uttarakhand Ayurveda University in Dehradun, and he is also teaching UG and PG students and has clinical experience in the field of Shalyatantra for more than 15 years. He is member expert committee on Marma therapy, CCRA's Government of India. He is a panel expert and author for Ayush Introductory Curriculum Development for MBBS graduates of AIIMS Rishikesh in India, and appreciated by the World Association of Former United Nations Interns and Fellows headquarters in the New York. He is founder president of International Marma Science and Yoga Foundation, Dehradun, India. He is a jury member in the National Biomedical Research Competition organized by AIIMS Rishikesh in 2018 and PGH Chandigarh in 2019. He is invited as faculty member in International Conference on Wound Healing by AIIMS Rishikesh in 2019. And he has done many international and national paper presentations, and he has organized live surgical workshops, which was the first in India on the institutional level in steam ablation technique in varicose veins, and many accolades. And he has traveled around more than a couple of dozens of countries around the world, which have included delegates from more than 50 different nations, conducted Ayurveda Marma therapy workshops and guest lectures in them, including at Indian Embassy in Tel Aviv and Hague. And he has trained hundreds of doctors in India in the field of Shalyatantra. So without wasting much time, it's our great honor and privilege on behalf of Kerala Ayurveda Limited. We would like to invite with your warm welcome and huge applause to Dr. Shishir Prasad to share his expertise today. Thank you, Doctor. Over to Dr. Shishir Prasad.
Thanks a lot, Dr. Anil, sir, and dear Dr. Godwin. And best of all, I'm still a student after all this introduction, and I still consider myself a student. So, and will remain so. Thank you, Dr. Dhanya, for inviting, and the whole team of Kerala Ayurved. It's a great pleasure and an honor to be here. And I think we can begin the talk now and share my presentation. Okay, thank you. So I'm going to share my screen now. One moment. So the talk today is Marma therapy in osteoarthritis knee. So first we'll go to the basics, just in few background of Marma and Marma therapy, then specific method of treatment through Marma points for osteoarthritic knee, self Marma therapy, how we can do it on our own, and of course, live demonstration online. I will try to make it as useful as possible. My presentation will focus more on the practical aspects rather than on the theoretical aspects. Of course, some theory will be required. So the basics about marmas, we all know. Marmani nam mans siras nayu asthi sandhi sannipata teshu subhaveva prana tishtanti. The marmas are considered as a conglomeration of the mans or the muscular system, the sera or the vascular system, snayu or ligament and tendinous, asthi is bony, sandhi is joints, and where by nature pran resides. So these are therefore considered as a very vital or important energy points. And since the term prana has been used here, prana is actually, of course, in plural form. So we will consider Dwadash prana, not only the prana. The Marma word meaning, we know that it can be used as a vulnerable point, any open, exposed, weak, or sensitive part of the body, joint of a limb, any joint or articulation, core of anything, any vital member or organ, anything which requires to be concealed, secret in quality. So all this comes down to the gist, comes out to be like they are something which is very sensitive and very, very important. Marma science in Ayurveda. Sushruta has mentioned Maryanti iti marmani, as Ashtanga Sangra also has mentioned apicha marankaritvat marma. And the genesis of word marma is mrumanin jivasthane sandhisthane tatparyacha, where here ma means pran or vayu and rep denotes house or seat. So Acharya Sushruta has basically described marmas in a very detailed manner. And he has mentioned that if there is any severe injury on the marma site, then it can lead to fatality. Ashtanga Sangra has also is of the same opinion. Sushruta has basically described marmas in the context that you have to protect the important energy points so that especially while performing surgery, so that you do not injure them because they are very, very sensitive part. But then the question was asked, and it's quite often asked when I do the talks, that Sushruta has mentioned about the surgical aspects of marmas, then why and how we are using marmas in a therapeutic way. So there are certain references in Sushruta which says that Sushruta has utilized this knowledge of marmas in therapeutic ways, in different ways, in different chapters. There are many places in which Sushruta has mentioned the therapeutic implications of use of marmas. For example, if you go in the 5th chapter of Sushruta Samhita Sutrasthan, and then there is a shlok where there's a special kind of dhupan dravya that Sushruta has mentioned, and he has mentioned that out of those dhupan dravya, the same dhupan dravya should or can also be used as in a ghrith form, and that ghrith form has to be applied on pran sthan, and pran sthan Sushruta has mentioned. Sushruta has mentioned the use of the herbs, that specific alep on the marma side. And not only that, there are many places in which Sushruta has mentioned about the therapeutic aspects of marma, in the sense that you have to use your yukti. Because see, if we go on and see the Raktamokshan chapter itself, and in Raktamokshan chapter, Sushruta has mentioned that you have to do bloodletting for certain disease at certain specific sites. For example, in splenomegaly or plihodar, you have to do Raktamokshan from Bahampur. For Gridhrasi, you have to do in from Dolim Janur. The specific sites are mentioned for Raktamokshan. So if the idea of doing the Raktamokshan and giving the benefit just by taking out the blood, and yes, we do know that taking out the blood also has its own good effects, of course, in a specific quantity. So it has its own effect. But if the idea was to give relief to the patient by only taking out the blood, and then it could have been by any vessel. Why specific site of Raktamokshan has been mentioned? So this, if we use it, then we can consider the only plausible, and the answer for this is that the Acharya Sushruta actually knew that that specific site is related to particular organ or organ system. And that is the reason why Sushruta mentioned that do Raktamokshan from that site or this site for a specific disease or for a specific dosh type. So we have to just use our yukti and understand that where and how Sushruta. And not only that, not only Sushruta, in Charak Samhita, in Ashtanga Samhita also, there are so many references where, for example, we are often doing the Hridabasti, we are often doing Shiropichu, we are doing the Janu Basti. In all of these places, we are putting, or we are stimulating the marma sites, but we are not causing any injury. So this term, that Maryanti iti marmani, was quite often used by the detractors to say that how and why should we use the marmas when we know that it can cause fatality. But the answer to that is that we are not causing any severe injury, which Sushruta had meant by the term marghat, but we are reusing it in such a way that we can produce therapeutic effects. And it has been mentioned in different Samhitas, in different ways of stimulation. It's just that we have to use our proper understanding. The importance of marmas was so much that that means half of the surgical science is marmas. So the importance of marmas are quite widely understood and explained by Acharya Sushruta. So now coming to what is marma therapy. So marma therapy is the art of stimulating the marma points exactly at the right time, place for rechannelization of energy, yielding better energy flow and optimum therapeutic effects at physical, psychological, as well as spiritual levels. Coming to the probable mechanism of action, but based on energy concepts, based on Tridosha concepts, and based on modern parameters. Marma's energy-dependent science. So I'm going to explain more about the energy first. So we all know that each one of us emits certain radiations. Sometimes, and very rare people can actually see those radiations and see those energy field and assess it. However, not everyone can do that. So to bring it on a scientific parameter, to bring it on a black and white paper, this experiment by Professor Korotkov and the team is very important. And Professor Korotkov is a very well-renowned scientist in St. Petersburg University, Russia. And he had carried a lot of work regarding the energies. And actually, in his research paper, he has mentioned that he has taken the concept of these energies from our Ayurvedic Samhitas. And you see, if you're able to read this, the chakra analysis and all those things have been mentioned and analyzed by Professor Korotov and the team. So what they did, took a water droplet and mapped the energy field of that water droplet by using a specific camera. Some of you may already be knowing about it, but this is a very important one. And there are a lot of energy dependent signs, and this experiment actually gives it all those energy dependent signs a very solid scientific background, because whether it is yoga, whether it is Reiki, whether it is pranic healing, whether it is magnetotherapy, whether it is aromatherapy, whether it is, of course, Marma science, they are all energy dependent signs. So what they did was this water droplet mapped the energy field, was converted the invisible spectrum to the visible spectrum. And this was the energy field before charging it. And then he asked an energy healer by the name of Alan Shumack. And Alan Shumack did 10 minutes of conscious concentration on this water droplet. And after 10 minutes of conscious concentration on the water droplet, the energy field was 30 times stronger aura. And here it is written, the difference in the bioenergy glow is dramatic. The biochar has significantly altered physical and biological properties. So if you can change the energy field of water, you can, of course, change the human bioenergy field. And this has also been shown in different experiments. And of course, a meta-analysis was also done regarding after this experiment. And we have already had a few papers published. There was a paper published on pattern identification and thought form images. And of course, there were some of the first paper presentations done regarding Marma's clinical applications in postgraduate levels. This is another top paper that we published, identification of manas or states of mind simulation studies in biophotonics, and of course in collaboration with the electrical engineers and other doctors. So now, and yes, besides those, we can also understand the concepts of the tridosh, like for example, if Apanga Marma, the Marma Ghat, it is mentioned that Marma Ghat on Apanga Marma leads to Drishti An. So that means the Drishti, we know that it's related to Alochak Pitta. So the Apanga Marma is related to Alochak Pitta. We can infer like that. So if it is a Krikartika Marma, Chalab Chal Murdata. So from the Marma Ghat Lakshanas, we can infer to some extent the involvement of the different doshas. And if we go into the historical background, Dr. Anil was saying that it is mentioned in Kalaripayattu, and that we know, and it's one of the oldest form of martial arts, and actually the mother of all martial arts, Kalaripayattu, and the basis of that Kalaripayattu is the Varmam science, and the basis of this Varmam science is has been there in Siddha literature. And the first reference of Varmam has actually come in the Rig Veda, where the term drapi was used. And drapi, we know, is a certain protective cover that you have to wear when you go to war. So since the word Varmam has actually come in the Rig Veda, so we considered it as one of the oldest known science to humankind. Now, in the same context, we see that the father of Siddha is Agastya Muni. And there is a very wide description of Varmam, including the doshic involvement in Siddha literature. And fortunately, the manuscripts survived the invasion by many of the foreign invaders. And fortunately, we do have states of Varmam. The father of Varmam science is Agastya Muni, and if we see that the reference of Agastya Muni has come in the first chapter of Charak Samhita, where it is mentioned that there are 53 rishis that learned the science of Ayurveda. And among those 53, there is a reference of Agastya Muni. So it is likely that the Ayurveda and Siddha at that time was contemporary. It is just that the language used were different. So maybe there were two parts of the same coin. Now, coming directly to the topic today, without going into further theoretical aspects. So if you have any queries later, we can talk about the theoretical aspects also. But anyway, now we are going to discuss about what we do in cases of osteoarthritis knee. And we know that osteoarthritis knee is one of the commonest problems nowadays, and there are several factors responsible for it. I'm just going to tell you what marmas we do in such cases. And they are the Janu, the Indravasti, the Gulf, and the Chipra marmas. So these four marmas we generally do in our patients of osteoarthritis knee. Regarding Janu marma, it is mentioned, Jangha Uru Sandhane, Tatra Kanjata. And that means it is at the junction of the thigh and the leg region. So it is a joint, knee joint. And if there is any injury, then it can lead to debility. The type is Sandhi or a Vakalekar marma. Numbers are 2, and the size is 3 angul or 3 finger breadths. So there are two methods of stimulation of the Janu marma. One is the anterior approach, and the other is the posterior approach. So this posterior approach we generally avoid for the beginners, because in the posterior region of the knee joint there is the presence of many blood vessels. So although this Janu marm is a Sandhi marm, but still when we approach the marmas from the posterior region, then we do it like a vascular marma. Okay, so we have to know which marmas are of which type, because the amount of pressure that we need to apply on such marmas will vary depending upon the marma type. And if it is a Sera marm, generally speaking, then the amount of pressure that we apply is much lesser as compared to the other 4 types. Okay, other 4 types, that is the Asti, Sandhi, Mans, and Snayu. So other 4 types, the more we apply much less pressure. What I'm going to talk, or what I'm talking, is the stimulation of marmas through digital application of pressure. Digital means through the hands, not the digital computer world digital, but the digits or the fingers or the palm. So that part we are using for doing the stimulation. Of course, there are many ways in which marmas can be stimulated. There are ways in which marmas can be stimulated without even touch, or just a matter of touch, or it can be stimulated just by doing pranayam or yagya. And there are various ways in which a marma point can be stimulated. What we will be talking and seeing today is the stimulation of marmas through our hand. So when we adapt the posterior approach, we use the pulp of the 2 thumbs, very gentle application of pressure in the popliteal region. You can say around 1 pound pressure to begin with, and intermittent pressure. Press and release for 15 times in one sitting, and 2 to 3 times in a day. One press and release will take approximately 3 seconds. The rate of, or the rhythm of press and release is the same as we adapt in or we compare it with the rate or rhythm of breathing. So this anterior approach is the one which we practice more. We use the thenar eminence on the boundary of the patella. If you can see, patella is a triangular bone, we all know, cartilaginous bone. So you place the thenar eminence close to the patellar boundaries. The distance between the 2 hands here should be not much. This is one of the common mistakes people do when they practice this marma point stimulation. So the distance is approximately 1.5 finger breadths on the lower region of the patella. Okay, so the direction of pressure is again very important. Once we have identified where to place the thenar eminence and how to place it. The direction of pressure becomes important. From this point, we draw an imaginary line towards the popliteal fossa, mid-posterior line in the popliteal fossa. So that is, we draw in an imaginary line like this in the popliteal fossa and apply pressure through the thenar eminence towards that popliteal, that imaginary line. While doing so, there are often chances that your fingers will tend to move more towards the central region of the popliteal fossa. And then when we're applying the pressure from this side, then there's a counter pressure with the fingers, which you're not seeing in this figure. But the chances that these fingers will exert a pressure in the central part of the popliteal fossa, pressure on the anterior aspects. Okay, so we have to be careful and not do that, right? So what we will do is we will place the 4 fingers on the boundaries of the popliteal fossa posteriorly. These fingers will be going in the boundaries of the popliteal fossa on both the sides. And then when we apply the pressure from this side anteriorly, the counter pressure will be only on the sides, and they are more muscular here. So you will not cause any injury on the vessels lying in the posterior region. Now, this is the number of times that we do this stimulation is 20 to 25 times in one sitting, and again 2 to 3 times in a day. The amount of pressure is quite adequate. It's a moderate pressure that we apply here. If anyone has any implants or surgical intervention or any fractures around the area with the recent one, so then at that time you should not be stimulating this part. Of course, also if the patient has traumatic knee joint effusion, then it's better not to, or infective or tubercular knee effusion, then we should not be stimulating at that site and with this amount of pressure. It can be more gentle with just a small touch rather than applying any pressure on the site. Now coming to the next one, which is the Indrabasti Marma. So regarding Indrabasti Marma, it is mentioned that they are 4 in number. It is Mans Marma or Kalanta Pranhar Marma, and the size is Ardh Angul. Here it is also mentioned, if you go into the Marma Ghat of Indrabasti, then it is mentioned that it can lead to blood loss. So you see, the Marma, this Indrabasti Marma is a Mans Marma, but Marma Ghat Lakshana has been mentioned that it will lead to blood loss. So this means that although it is a Mans Marma, there has to be certain vessel close to the Marma site, right? So this is how we will identify where the location of the Marma will be. So if you go by the anatomical aspect and description of the Marma site, then basically at the point where the 2 bellies of the gastrocnemius has ended in the middle, so these are the 2 gastrocnemius muscle bellies, and where these 2 have ended in the central, so that there lies the Indrabasti Marma. Okay. However, we have seen in clinical practice that if we do the stimulation at this site, formation. So while doing this stimulation, we will not be stimulating at this site, but we'll go approximately 2 finger breadths below this actual site and then do the stimulation. So I'm going to explain again this one to be better. So you can see the patient is lying down in the prone position, and this is the actual site of the marmas, right? But when we do the stimulation here, there will be chances of hematoma formation. So we go 2 finger breadths down. So this will become the better site of stimulation for this. The Indrabasti burn is best stimulated when the patient is in the prone position. However, it can also be done when the patient is in the sitting position. the approach or the method will differ in either whether the patient is in the sitting position or when the patient is in the prone position. So if the patient is in the prone position, then this is how we do it. We do with the help of the pulp of 2 thumbs and intermittent pressure, directly downward direction. So it is quite easy and to understand direct downward pressure intermittently. We will be doing 20 to 25 times in one sitting. So another way of identifying this is when we can take or we can measure from the sole of foot approximately 12 finger breadths above. Right. So from here, we go approximately 12 finger breadths above. When we are measuring from the sole of foot, then the foot should not be hyperextended or hyperflexed. It should be at 90 degree, not in the way in which the picture you can see that the foot is hyperextended. So not in this way, the foot should be at 90 degree, and then only we should measure the distance for identifying the site of a stimulation of the Indrabasti Marma. So press and release in the same rhythm in which we take our breath in and out, and press when you exhale and release when you inhale. So this is the rhythm that we generally follow. See, there are many patients who will come to us in which we will not be able to stimulate always or in the same rhythm in which the patient is taking the respiratory breathing. Okay, so that is fine. It's not essential that if the patient is in your OPD and you try patient is in the prone position and then you are seeing whether the patient what time is breathing and what time. So it's not essential in that case. We are doing otherwise as well. However, when we are doing the self-Marma therapy and on a regular basis for a prolonged duration of time, then we can better match it with the rhythm of breathing. So we can do that, and at that time it is advisable that we try to match it, right? See, the breathing rate is approximately 18 one press and release. Now coming to the next Marma site, it is mentioned regarding Gulf Marma. So it is Padajangyo Sandhane Gulfona Tatra Ruja Stabdha Padata Kanjatava. So it is mentioned that it is the junction of the leg and foot. Okay, and if there is any injury, then it can lead to a lot of pain. So regarding Rujakar Marm, we know Gulfodho, Manibandhodho, Dve Kursharansicha. So there are 8 Rujakar Marm, and Gulf is one of them. It is a Sandhi Marma, and the size is Dve Angul, 2 Angul. So now coming to the description of the Gulf Marma and how to do the first understanding where the Marma site is, and then we'll see how to stimulate it. So if this is the middle part or the highest part of the median malleoli, we go approximately 2 finger breadths. So when I'm talking about 2 finger breadths, it means this finger breadth, and it is the patient's finger breadth. It's not our own. Right, and to understand what is 1 finger breadth, the easier way is you just measure the base of the 4 fingers and divide it by 4. So that becomes 1 finger breadth, right? So that way also we can understand it. And this is one of the Marma site, which is at the time of stimulation, it is painful. So we have to prognosticate our patient that when we are stimulating this, there will be some pain sensation or current-like sensation going up to the back region. So it is better to be done under when the patient is in the supine position. It can be done in sitting posture also, but you have to see what the patient is. Okay. So we make a curve here, just like this, 2 fingers. So when we make a curve, it is actually along the line of the tendon, which is lying here, and you can actually feel that tendon. And along with the tendon, there is a branch of the posterior tibial artery, and of course, also the posterior tibial nerve branch is lying around in this area. So and it is quite superficial. So that is the reason why when we are going and stimulating it, then there is a tingling sensation or electric current sensation which we feel at the time of the stimulation. It is not like you will always feel this even after you have done it a number of times. It's not like it is the initial stimulation which will be however, it is also very, very effective in cases of osteoarthritis knee. And not only that, actually, we are doing it quite often in low back pain patients as well, sciatic pain patients, and a variety of other cases. We are doing this Gulf Marma. So, although today I'm talking about the osteoarthritis knee one, but the same Marma can be used in a variety of other cases. So, now once we have identified it, here this is the technique of doing the stimulation. That is, we place the thumb on the anterior aspect here just for support, right? But we have to remember, we don't press it too hard here. Okay, so there's a specific vessel which is going underneath. But for support, we'll place our thumb on the ankle and use the index finger, just like placed like this. So make the index finger like a hook and try to feel this rope-like structure. So once we have felt the rope-like structure, we have to slightly elevate it and then release it. Not much pressure, which is important. Pressure is to some extent important, but very important the technique that we follow. Because if we start rubbing in the area while doing the stimulation, then there will be swelling and pain can increase. So we have to be careful not to rub on the area with, like, when we are placing the finger on this side and trying to find the location. This is a common mistake that people do, try to rub on the area. So no rubbing should be done. Only go back towards the tendon and just slightly elevate it and release it. That's all. And again, do it 20 to 25 times in one sitting and 2 to 3 times in a day. Another thing that we see in clinical practice is sometimes when you do the stimulation, some patients can have itching sensation. That itching sensation is mostly confined to the foot area, and that will go on its own in 10 to 15 minutes. So that also we have to prognosticate our patients, right? So that the patients are aware that what is going to happen, okay? Now, one more thing which is important is where we put the major part of this, or where we apply more, can say, the pressure, or where we place this index finger. What is the part where we do it? So that is approximately 45 degrees angle from this line. So if you draw a straight line like this, so this angle becomes approximately 45 degrees. It's not necessarily always 45. It can be 40 degrees, it can be 35. There can be certain variations depending upon the patient. Some patients are obese, some are very lean and thin. Lean and thin patients you can easily identify. Some patients who are obese or have already swelling in the area, have bursitis in the area, then there can be slight variation. The idea is to first locate that rope-like structure and then just elevate it. Just like you pull a guitar string, in the same manner, we will do it. Now, there are two sites of stimulation for the Gulf Marma. This is the lateral malleoli, and from the lateral malleoli, we draw a straight line downwards. And again, this distance is approximately 2 fingerprints. Okay, so now what difference that we see from the medial aspect is that the direction, or you can say directly perpendicularly on this side, and instead of making a 45-degree angle. Another difference is that this rope-like structure that you will see is thinner as compared to the other side. And here also we will do the same thing, just slightly elevate and release it. The tenderness at this site of stimulation will be there, especially in the few cases. Compared to the medial side, it will be slightly lesser, but it will be there. So we will have to prognosticate our patient that be aware. Okay, and while doing the stimulation, the foot should be placed at the holding the foot with one hand and using the index finger with the other. So this thumb is for support on the ankle, right? And then slightly elevating and releasing. Once you do it, the patients tend to make their muscles in the foot area very stout, or in the leg very stout. So we have to tell the patient to take deep breath in and out, and also that the patient should keep as much relaxed as possible. You can slightly flex the knee if the patient is in the supine position. Regarding the Chipra Marma, it is mentioned, Tatra Padasya Angusht Anguli Madhya Chipra Nam, Tatra Vidhasya Achepnam. So if there is any injury on the Chipra Marma, then it can lead to achep-like symptoms. And the site is actually in between the Angusht or the great toe and this second toe. The numbers are 4, 2 in the upper extremity and 2 in the lower extremity. We are discussing about the lower extremity Marma today. It is a snayu or a kalanta pranarma. The size is ardha angul, half angul. So the site of a stimulation is 1 finger breadth above. Okay, so from the webbing in between the great toe and the second toe. So if this is the webbing in between the great toe and the second toe, then you measure approximately 1 finger breadth. Okay, and then once we have identified it, use the pulp of the thumb to stimulate it. The direction of pressure is slightly towards the thumb instead of directly downwards. So slightly towards the thumb, you can say approximately 15 degrees towards the great toe, the direction of pressure will be. And the index finger will be placed just behind this point, because there are certain references that Chipra Marma lies on both the sides, so on the plantar as well as on the dorsal aspect. So when we place the index finger on the other side, we're actually stimulating both the sides. Okay. The number of times that we do the stimulation for the Chipra Marma is again 20 to 25 times in one sitting, again 2 to 3 times in a day. So when I'm talking about 2 to 3 times in a day, then it can be in certain cases. For example, if we're doing for different other diseases like hemiparesis patients, paraplegic patients, quadriplegic patients, and other chronic, even up to 5 times a day, right? But generally, more often, it is 2 to 3 times in a day. So these are the 4 marmas that we practice in patients of osteoarthritis knee, at various stages of osteoarthritis knee, to very good effect, especially the range of movement or the ease of movement is much better. The pain subsides and the mobility increases in osteoarthritis knee patients. And we have seen effects very quick. So one of the advantage of using this marmas is that the effect is very quick, and the patients nowadays want quick relief. So once you are using marmas and able to give relief to the patient even after first sitting, then the patients also take the medicines that you prescribe more religiously. Okay, so how many times or how many days that you will need to do it, that will depend upon the stages of osteoarthritis or the associated complications of osteoarthritis knee, because we know that, see, osteoarthritis knee are also sometimes a complication of avascular necrosis femur, right? So we have to understand the pathology behind it, existing diseases behind it, and then understand how many times that we need to do in a patient. Generally, around the women are more affected, and you can do it even 2-3 months, 4 months for a good relief. The other question that comes at when does the effect starts to come? Then the effect will come even after the first sitting itself. I'm going to show you some of the videos now for the stimulation of these marmas that we have discussed today. And then I will also show myself how to do the self-marma therapy of these 4 marmas.
आसन विहार
First Indra Basti Marma, sure. Then we'll see Janwar soon. Right, and approximately 12 finger breaths from here. Okay. This belly actually ends here, but you have to chances of swelling. So be a little downwards with the help of 2 thumbs. This is actually was going on in Poland, so that is why Polish translation is also going on in the background. Okay. Adequate amount of pressure. The patient is on the front like this, so not to do it like this. Not to do the pinching action. See, the skin, the thumb has to be more parallel to the skin surface rather than elevating it and then pinching. No, not like that. Okay. Okay. One of you can practice here. Okay, so this was the Indra Basti Marm. Now I'll show the next one, which is the Janu Marm. One moment, please. Be placed here. This is not much painful. Okay. Be placed here. This is not much painful. Fingers should not go in the back, not like this. Fingers outside peripheral region. Yes. So this is what I mentioned here. When we have to, this distance is not to be too much. This is one mistake that people do. So we have to keep our thenar eminence as close to the petal boundary as possible. Okay. Don't really feel. Okay. So if I'm to do it myself, then like this. So this is the self therapy where the patient is placing again like this, you see. And of course, at present, the patient is on a bed, but you can also do it in sitting position, the same thing, with the knee flexed at 90 degrees. Correct. Yeah. So I'm going to stop the screen share now, and I'm going to show it myself, the other marmas, how to do. One moment, myself, the marmas. So,
You are on mute, doctor. You can't hear you.
okay, so now there are two views that you can see. So in one view, you can see my leg here, right? So should I make this spin? Let's spin. Right. So what I do is I'm going to draw a line here, just first to identify the Indrabasti Marma, right? Okay. Now, once I have identified, so now you draw four fingers, and four, right? So basically this, right? So my gastrocnemius muscle has actually ended on this point. Okay, so it has ended here. So 2 finger breadths below. This is the point of stimulation for the Indrabasti Marma. Okay, now I'm placing my foot on the thighs. Now, where you are placing your thigh is important, because what people tend to do is place it like this. So then the foot will move like this. So then you will not be able to properly identify where the site of stimulation is. So what we do is we have to place this angle outside the leg and then do the stimulation. That is, now place the 4 fingers on the medial malleoli, right on here. Don't go too far downwards. The little finger should not go too far downward. Then you will not be able to reach the proper place. So put the little finger on the medial malleolar area and use this part of the thumb. The thumb actually goes directly here once you are placing it correctly. Right now, once we have identified the site, then we can use this one part of the thumb to do the stimulation and apply the pressure in directly opposite direction. So like this, right? So this is the amount of pressure that we need to apply here. Okay, 20 to 25 times. So now this is the technique for Indrabasti Marma. So I hope it is clear to all of you. Next, we'll go to the medial side or the inner side of the stimulation of. So from the medial aspect, or the highest point of the medial malleoli, we draw approximately 2 finger breadths. So you make a curved line like this. Okay, and now this distance is 2. So now what we will do is we will use this part of the index finger. So we will use this part of the index finger to place it on this point, right? Like this, and then place the thumb on the other side. So this is just for support here, not applying anything extra pressure on the Marma side, on the side, rather just place for support here. We are doing this, placing like this, and use this part to place to elevate that rope-like structure that we have identified, right? So if you can see, right now you can see it clearly. Make it like this. Okay. So no. This was okay. Yeah, this is correct. So like this. His hand. Okay. I think that is the other one has hanged, so I'm going to show it on this view. Okay. So okay, so this is how we will be doing it. So this is the medial aspect, and the lateral, the other aspect is by placing yeah, you can see now, one moment. So the lateral aspect now, we will be seeing. So I will be placing my foot like this, and again, so this is 2 fingers. So now I'll be using here. You can see. So this is the movement that I need to do. That's all. No, not like this. No rubbing should be done. If you do the rubbing, then it is not good. So just place it here and slightly elevate it. That's all. This movement. Similarly, here also the medial that I was showing, it is, if you see my finger movement and watch my finger movement, see now, my finger movement you will see. That's all. Okay, that's all. No, not like this, not like this. Just going behind, elevating, that's all. That's it. So this is the Gulf Marma, and the next one, which we'll be seeing, is the Chipper Marma. So the Chipper Marma, of course, from the webbing, we draw 1 finger breadth. So 1 finger breadth like this. And this is quite easy to do. Just use the pulp of the thumb for holding it here. Okay. So this is hanged again. Yeah. So just slight pressure towards the great toe. That is all. The fingers, this finger I have made like a hook and placed it again posteriorly, just opposite. And this is how we will be doing the stimulation. Again, 20 to 25 times in one sitting. So this was about the 4 Marmas, and if there are any queries, I can take up the queries now. Thank you.
Thank you, Dr. Shishir, for your wonderful talk with the practical demonstration on the Marma therapy. So we learned a lot. So we have a few questions. I can maybe ask a couple of them.
Mm-hmm.
So is it effective in plantar fasciitis? That Marma Chikitsa helps in plantar fasciitis?
To a large extent, we are doing it in plantar fasciitis patients, and is the Kurch Marm and Talahida Marm and the Gulf Marm. So these 3 are the ones which we practice, and you will be happy to know that one of my fellow colleagues has actually joined the PhD course, and he asked me which topic should I choose. So I said, okay, you can take up plantar fasciitis, Marma Chikitsa in plantar fasciitis. So the synopsis has already been accepted for PhD thesis now in Marma therapy in plantar fasciitis. We have clinically, we have a lot of patients treated through Marmas. But of course, when you're doing the treatment for plantar fasciitis, you have to actually know that whether it is plantar fasciitis or it is calcaneal spur, because one of the common problem, another common problem with pain at the similar site is calcaneal spur, where there's a bony growth of the calcaneum. So we have to rule it out, and it can be done easily when you do an X-ray. So yes, we are doing in plantar fasciitis patients these 3 Marmas. Again, I repeat, the Kurch, the Gulf, Talahida Marma.
Okay, thank you, doctor. That's great. So in osteoarthritis, by doing this Marma therapy, is there a possibility that we can revive the cartilage, damaged cartilage?
If I can do that, I will get the Nobel Prize.
That's great.
So
So,
yeah, but yeah, but then the question is, how do
there
we
are
give
internal
it,
medicine. Yeah, there are
right?
internal medications and all.
Yeah, there are what happens is actually you provide more strength to the surrounding structures, and the surrounding structures, providing strength to the surrounding structure is one of the aim of other treatment modalities available, right? So in Marmas also we do this, and there is a decrease in the swelling and pain because of it has been seen that there are release of certain opioids when you are doing the stimulation of these Marma points, or the energy points. Basically, when you're doing the energy point stimulation, it has been shown that there are release of opioids, and that opioids helps to reduce inflammation as well as pain. If you try to understand on more in correlation or the probable mechanism based on modern concepts, of course, if you try to understand in the Ayurvedic way, then we see that there are certain Vat involvement, of course, we know, in Kapha. So these Marmas help regulate the blockages in the channels and open up the channels, and thus have a better energy flow in the area, producing proper results.
Wonderful. Thank you, doctor. So is there any book available for learning practical Marma therapy which you can recommend?
Yeah, there are certain books available now. Very recently, the CCRS has also launched a book on Marmas. So that is one thing that one can look for. And one of the books that I do refer to is also one of the book by Dr. David Frawley. I have gone through it. Of course, the techniques that has been mentioned, that I have mentioned, those techniques are not mentioned in the books there, right? On the amount of pressure, that is actually not mentioned in any of the books. What amount of pressure that you need to apply on each of the Marma sites, right? And so it is basically an experience-based, the amount of pressure that we need to. I do share it in my different talks in different places. So I have just written one of the booklets where I have mentioned it, but it is still not open for public distribution yet. So let us see when it comes, then you will be able to know exactly what the pressure, the direction, because not every book has not mentioned about pressure. In Vermont, there is in Vermont book that by Dr. N. Shanmugam, you have the Vermont practices where they have mentioned about what amount of pressure that needs to apply in a Vermont approach to this, right? So they have mentioned it there.
Great, doctor. So in osteoarthritis, up to what stage our Marma therapy will help the patient to avoid the knee replacement surgery? Like on what stage they have to contact you?
If the joints have not fused, basically, right? If the joints have fused completely, then I would advise for TKR. But if the joints have not fused, if there is a space vacant, if you can see even 1 millimeter of space, which is a much reduced space, but even if you can see even 1 millimeter of space between the joints, then you can give relief to the patient. Even up to the grade 3, you can give relief to the patient. The 4th grade is quite difficult where the joints are fused. Then, but there are patients, say for example, 75, 80 years, who don't want to go for surgery. Even if it is a later stage of osteoarthritis patients. So those patients who do not want to go for surgery and they keep suffering. So in such cases, we should be doing the Marmas. And even in such cases, the patient's pain pain will reduce, and of course the mobility will increase.
That's wonderful to know. And so up to what age it will be effective?
At any amount of age, you can use it. Marmas basically can be done from infant till the last stage. In osteoarthritis, we know it doesn't happen in the earlier stages. It happens more in the after 40, 50 years more often. So yes, you can do it. For example, 85, 90-year-old, then the pressure that I said, for example, if that have to apply approximately 8 to 10 pound pressure in case of in case of Janu Marm, then in such case of 85-90, you cannot do that. You see, you will have to reduce the amount of pressure in such cases, depending upon the patient of, and not only the age, basically it also depends upon the sattva of the patient, prakriti, and those things. Where suppose if the patient is hina sattva, then the amount of pressure will vary.
Okay, great, doctor. So last question, final question. Is there any like courses where any BMS doctors can attend and learn about this?
Yes, just very recently, our university has launched a course, a diploma course, and as well as certificate course in Marmas, which is 3 months and 6 months duration. So you can this will be the first batch, for students, and I think the date has already passed. So for next batch, you can apply, and anybody who is interested, it is open to BMS, BUMS, BHMS, and BYMS. So all the bachelors in Ayush pathies, they can join these courses.
So they can apply through the university website.
Yeah, that to the university, but not university has a certain limit of doing it. So on foundation level, I am doing it through my foundation, different courses. I am arranging online courses, and through my foundation, I am providing certificates to whoever is interested. We have already carried out around 7-8 batches of advanced course during these COVID times, and yeah, we have done in more than 20 states. Recently, just 3-4 days back, I was in Mandi, Himachal Pradesh, with the CCRS of Regional Ayurveda Research Institute. A practical hands-on training of Marma Chikitsa for government Ayurvedic medical officers of Mandi district. So 32 medical officers joined, and we trained them there in 2 days. And others earlier also, there was the Directorate of Himachal Pradesh organized 2 days, 2 batches of medical officers. So trained around 74 medical officers there. In Haryana, there are many districts where we have done these medical officers training. Nepal, you'll be surprised, in Nepal, around 450 Ayurvedic doctors are there, and I'm training all of the 50 Ayurvedic doctors in different batches. So it's already completed around 6 batches of training, and not only the doctors, approximately 1,000 to 1,500 paramedics. They will also be learning, because I was also training the paramedics. So all those people in Nepal who are related to Ayurveda, they are learning these techniques, and it is being performed from the ministry level, from the institutional level in Kathmandu. So there are a lot of things going on, and however, it was not so in the initial few days, because when I got the first clinical thesis on Marmas done through one of the students, Dr. Lotika Bharti. So that, because we earlier had a lot of thesis work in case of understanding the anatomical aspects, but not much thesis work in understanding the Marma's clinical thesis work. So that was one of the first thesis in clinical applications of Marmas. That time there were a lot of objections raised, especially with this sentence that Marianti iti Marmani, why are you touching the Marmas? So, but anyway, we got it through, and the rest is history now. So gradually, with the help of all the fellow colleagues and people like you who are distributing Ayurveda in different fields, we are spreading the sign, because I do say that Marmas are one of the oldest known science, and it is a gift of our nation to the world. It is a gift of our Ayurvedic sciences to the world.
Wonderful. Thank you so much for explaining in detail, Dr. Shishir. And we are so happy to have you for taking your time in your busy schedule to be with us in this 1 hour. So we learned a lot, and I'm sure this wonderful specialty of Ayurveda will grow leaps and bounds with your expert knowledge and your overall help in learning, helping many people to learn. So I would like to hand over to Dr. Anil for closing out today. Thank you.
Thank you, Dr. Godwin, for moderating this webinar. And I have one question to Dr. Shishir. Is it at any advantage is there to apply oil, medicated oil, before doing the Marma pressure? Or
Yes, you see, there are practitioners who are using oil for stimulation of marmas. Then this is one of the techniques which is followed. These same marmas that I have described, I have taught many of the patients and many of the students, and they are using this knowledge and to apply oil on those marma sites. However, I am describing more on with the digital application of pressure, but they are using their yukti and modifying it and using oil to very good effect. Recently, I had very good feedback from Italian fibromyalgia, one of the lady in practicing the same marmas oil application in fibromyalgia patients. So the Italian Fibromyalgia Association, they wanted to have a talk regarding this. So yes, sir. We can use the same knowledge and use oil depending upon the patient's prakriti and those things we can use. However, when I am describing it in the way we are doing it, I'm not using any oil for stimulation of the marmas.
Okay, thank you, doctor. It was an excellent presentation, and the practical demonstration was very effective, so that we can understand it very clearly. And your mentioning of the aura of water, that was very interesting. We would like to know more about it through the net, and we will come back to you if you have any doubt on that. That is a very interesting point. And I think, when we talk about Ayurvedic practice, the specialization is very important for the progress of Ayurvedic practice. So in this context, if the doctors are practicing on osteoarthritis, specializing on that subject, they can include a Marma practice to that, so that the patient get very good relief. So I think this has given a lot of information to the coming up doctors, and I think more and more doctors will choose for Marma specialization from your talk, because this is very effective and given, and also it is giving fast relief. That is very important for this kind of era. So it was a very good presentation, doctor. Thank you for accepting our invitation and presenting this paper. Thank you very much, Dr. Shishir Prasad. Thank you very much.
Thank you so much, Dr. Anil. Thank you, everyone. And also, I would like to mention the name of my friend, Dr. Srijit. He's a very close friend, and I think all of you know about him too. And thanks to Dr. Srijit as well, besides, of course, the whole Kerala Ayurveda team.
Okay, thank you, Dr. Srijit, for supporting. And thank you all the participants and doctors for taking time at this late evening and attending this meeting. We thank you all on behalf of Kerala Ayurveda. And also I would like to thank our supporting staff for this webinar. Dr. Danya has been a very good supporter, and she has coordinated this webinar and led this webinar. Thank you, Dr. Danya. And we have Mr. Senthil, who is promoting and is backing up this webinar. Thank you, Senthil. And we have the IT team, Mr. Manigandan and Mr. Sumesh. Thank you all for helping to conduct this webinar in a good manner. Thank you all the participants and doctors. Thank you. We'll meet next time. Good night. Thank you. We conclude this session. Thank you.